Hello, my name is Mary Mayo. I'm the parent of a 31-year-old male with 22q. This is the third in a three-part series called Living with 22q Deletion Syndrome. The module that I'm presenting is about family perspectives. I'm active in the North Carolina 22q support group and also the VCFSEF, which I'll give you more information about later. And we thank you for your attention in this module. Our objectives for you in taking this module are that you'll become familiar with the major psychosocial challenges and the stressors that are involved in raising a child with 22q. We want you to be able to anticipate family concerns at each stage of the child's development and become familiar with resources that you can offer and support that you can offer to people with 22q. 22q deletion syndrome can be called several different names, which you'll hear over and over again in the interviews in part 2 of this presentation. Some people shorten the name to 22q, others call it velocardiofacial syndrome, and a minority will also refer to it as DeGeorge syndrome. The sources of information for this presentation are firstly a review of medical literature, and then we took feedback from parents on local and national support group websites to conduct personal interviews with families of children and adults affected with 22q11 deletion syndrome. The psychosocial challenges in families with a child with 22q. Firstly, part 1, we're going to review the medical literature. I wanted to briefly present the most common medical manifestations in 22q to provide a background for the studies I'll be reviewing. This has been covered extensively already in Module 1, but the reason I mention these now is to highlight the toll that it can take on families. Emotionally, financially, it affects the family dynamics, there's time away from work. From infancy onward, there are ongoing medical, educational, and emotional needs that must be addressed. And if you'll look at this slide, 70% of the kids that are diagnosed with 22q will have a congenital heart defect requiring surgery or multiple surgeries throughout their lifetime. Another 70% will have palate abnormalities. There's feeding difficulties, there's significant speech delay, speech therapy, surgery, and again, sometimes you'll hear stories about ongoing surgeries in the palate. And the vast majority of these kids and adults have learning difficulties that require ongoing developmental assessment, academic support, and parent vigilance or hypervigilance. 70% have immune deficiencies, so they'll get infections more often, the infections will last longer, there's a lot of missed school due to hospitalizations. I wanted to share a quote with you that verbalizes a struggle that really all of us parents face. The central struggle of parenthood is to let our hopes for our children outweigh our fears. We have all of these medical and learning issues to manage, and sometimes we need to remind ourselves to not let these get in the way of enjoying our children. And this notion applies to any parent, not just parents of children with 22q or developmental disabilities. First, let's take a look at parental stress with this condition. The Duke research team conducted interviews in 2012 about how the diagnosis of 22q was provided to them and how they reacted to it. One of the parents commented that it was a trauma. That's not too strong of a word because we were just reeling from it. For many families, the diagnosis comes as a shock, and it may take a while to accept the diagnosis and to adjust. With similar aims in mind, a research team in Sweden interviewed families of children about their reactions to receiving the diagnosis. The parents had children ranging in age from 2 to 40 years, with the age of diagnosis ranging from 1 week old to over 30 years old. Generally, the analysis showed that parents viewed the diagnosis as two-sided. There was ambivalence between relief and sorrow. The main difference was the age at which the child was diagnosed, as well as the problems that led to seeking the diagnosis. So during infancy, often with identification and treatment of the heart defect, the loss of the child they dreamed about, and the fear of what the future is going to hold is a huge concern. And if the diagnosis comes in childhood or older, there's really mixed emotions because you're relieved that you've ended the search for an explanation, and you finally now have some kind of guide for medical management. The parents described fighting against a headwind in terms of medical care and services. And it's so important how the diagnosis is delivered, the attitude of the healthcare provider, the atmosphere of the delivery, organization of follow-up and support, and it has to be tailored to each individual family needs. Parents also commented about the importance of how the diagnosis is delivered. Another study specifically evaluated the effect of receiving a diagnosis on adults with 22q. Parents and higher functioning adults with 22q provided feedback and were generally in agreement that the diagnosis was very important for medical management, providing an explanation, giving you a way to cope, facilitating access to special programs, funding support groups, and giving a psychological benefit of true sense of belonging. Examples of changes in medical management included access to 22q specialists, anticipatory care for things like vitamin D and calcium supplements, and access to published medical guidelines, giving a platform for advocacy. In addition to the medical issues, behavioral problems are also a contributor to parental stress. 60% of children and adults with 22q have clinical behavioral problems. These may include social problems, immaturity, attention problems, impulsivity. They may be withdrawn, perseverative thinking and speech, that talking about the same thing over and over again. It has been shown that in the developmental disability population, child behavior problems are the single most important predictor of a caregiver's psychological well-being. So this is a significant problem in our 22q population and often needs to be addressed. One study showed that parental stress in clinical range is about 3 times more common in the 22q population. Yet when asked about life satisfaction, their responses did not differ from the average population. This makes us wonder why. Maybe they have learned good coping strategies. Maybe they have good support from families, friends, support groups, and or partnerships with their healthcare and educational specialists. Another source of parental stress is the heightened risk of significant mental health disorders during adolescence and early adulthood. In fact, parents reported this to be the single most greatest source of anxiety. It's living with uncertainty, like waiting for the other shoe to drop. Lack of resources and the association between mental health and 22q keeping me up at night with worry. I don't know where to turn for help. Another source of anxiety for parents is disclosing the information about the 22q diagnosis to the child themselves. One study showed that of 8 families interviewed, 6 had shared the diagnosis with the child, but 2 had not. Although those children were at an age to receive the diagnosis, they could have understood it, the families just didn't have the words to say to make the child understand but not cause them emotional harm. Of the 8 families, 6 responded that they didn't receive advice from healthcare professionals about how to approach this conversation or what to say. In fact, one parent said, "I don't feel very well equipped at all. I sort of feel like I could use help with it. I just don't know what words to use so that she'll be able to understand." One way you could approach this is to provide the larger context for the family's struggle. This is really important, and we want you to be able to help our families with this. One parent reported a pediatrician who tried to reframe the family's situation. The pediatrician was very helpful with that. He gave me the analogy of a pie chart. You know, it's not a big circle that says 22q, it's slices. You know, he's this, he's that, and 22q is a slice in that chart. Since pediatricians are often the healthcare professional who sees these children on a regular basis, anticipatory guidance about these discussions may be provided. Generally, discussing the diagnosis in stages. Children may not want to discuss the diagnosis at first. So giving your families words to use so that children can understand in little bits as they go through asking the questions of their life. This leads us to our next subject, the importance of the family environment for children and adults with 22q, as well as how families cope. A quote we heard several times during our interviews, and again in this study, is, "It is what it is." This parent went on to say, "It is what it is part of who he is, and it explains some things, sometimes, about him." These parents are voicing acceptance of the individual with 22q, and the next few slides will focus on how the family environment may influence the development of the child. Several studies have looked into this topic. One study showed that families with a higher socioeconomic status had higher overall functioning and social skills. The reason for this isn't known, but it's possible that higher socioeconomic status may afford greater access to health care, to learning specialists. Maybe it also attenuates stress due to having less financial concerns. However, socioeconomic status is not correlated with higher neurocognitive functioning. Perhaps this is more closely related to underlying genetics, biochemistry, and less to the environment. Another study showed that the family's social environment and style of parenting were associated with social, behavioral, and cognitive academic outcomes, specifically the level of parental control and the organization of the family. Parental warmth was found to be associated with the child's conscientiousness and emotional stability. These are association studies and do not imply causation, and there may be other factors involved. It should also be noted that there's a higher level of marital conflict and lower warmth in parent-child interactions when the deletion is familial or inherited from a parent. The bottom line is that family life is important, and this is how you can help. Assist with obtaining additional resources, hooking your families up with social workers early in the process, recommend social skills training or family therapy if it's appropriate, and recognize when a parent lacks the ability to advocate for their child's education. Provide tools to help them. Emphasize the importance of a support group and help them locate local support resources. The last study I'm going to review looked at quality of life, which is really important because a child with 22q is affected within several domains, socially, emotionally, and educationally. This study compared kids with 22q to kids with other chronic conditions like asthma, diabetes, cardiac anomalies, and cancer. They showed that the impact upon the child's quality of life with 22q was actually greater than those other issues, those other conditions. They described cognitive fatigue as a source of this struggle, trouble paying attention, trouble remembering, trouble thinking on your feet. This study was interesting because it also looked at the strengths of 22q. A lot of these kids have a great sense of humor. They're very caring. They have kindness, persistence, and enthusiasm. And now in part 2, we're going to let the families tell you the story in their own words. We conducted video interviews with 15 families that have a 22q child ranging in age from 19 months to 31 years. We structured the questions and the discussion topics on research that we did through support groups and social media groups that generated a lot of discussion. And we've arranged them for you in chronological age in 6 different sections, from infancy ranging all the way to young adult, and ultimately decisions about childbearing and pregnancy. The first compilation of videos deals with infancy. You'll hear stories about receiving the diagnosis, the rush to address the immediate life-threatening medical problems, and fears of the future.
started sending me to a cardiologist, a pediatric cardiologist, and because they knew that she had a heart condition. They knew they were going to try to do surgery when I was pregnant, but they decided to, after the birth, that they would give her surgery. So they kind of knew that she was going to come out with a heart condition. That was the biggest part of her 22q. She was born, of course, she had surgery 2 days after I had her. The surgery went well. We got complications at 4 months. When she turned 4 months, she had, what do they call it? Children get RSV. They realized she had a small airway. She had to get a trach. We stayed in the hospital for about 6 months. And it's amazing to see how sick your child can be and then watch them recover from it. And with her, it's been really amazing. But like I said, she had a trach for 4 years. And the heart, back and forth to cardiac with the difference. She has a leaky valve, which they never repaired. They're scared to repair that now.
He was diagnosed at birth.
At birth.
He had a interrupted aortic arch where his aorta was detached from his heart, and he had a soft cleft palate. And then they were seeing the facial features at birth in Hickory, where we are, but they did not. The doctor said, I think it could be, but we don't really think it's 22q, but it could be. But then when the valve closed in his heart at 24 hours and he coded, they thought, and so they sent him to Baptist, and Baptist said, this is what we think he has, and it was confirmed through genetic testing. So Caleb was, when he was 4 days old, they went to take him to do the heart surgery, and they were putting a line in through his aorta at the top half of his body, and the line broke through. So he coded, and his heart stopped, and so they put a chest tube in. He got fluid around his heart and put a chest tube in, and weren't able to do the surgery that day. So he sat in the PICU with a breathing tube, got an infection in his trachea, and he just kept getting smaller and smaller and smaller. He wasn't able to eat, and then he had his aorta repaired. He had an ASD and a VSD repaired.
He was born in December of 1999. He spent 4 days in the hospital. He came home and he went back into the hospital mid-January. I was feeding him his bottle and his lips started turning blue, and it kept going and spreading. He spent 2 months in the hospital. 2 weeks after we went into the ER, he finally had heart surgery to repair the Trotology of Fallot. And then he spent a week recovering from that. And then he spent a couple of more weeks after that because he developed a blood infection.
Alex is our son, and he was born with 22q August 30th, 2012.
2012. So did you know before he was born that he had the...
We did not, actually. It was a discovery after. We knew prior to birth that he was going to have a heart defect. We just didn't know the extent of it and that he would be needing surgery as soon as he did, which was at 10 days after birth. So he had Tetralogy of Fallot repaired at 10 days old, and then after surgery, when they were checking blood levels and everything to make sure things were normal, they found the low calcium levels, and they put 2 and 2 together and did the FISH test to determine that he had the 22q. When they first did the ultrasound to determine the sex of the baby, they noticed there was some levels that were not reading right, and they sent us to a maternity specialist where they could see the actual heart formation and everything, and that's when they determined there was going to be the issue there.
And what was that like for you to find that out?
It was very overwhelming, and we also started going to the cardiologist in utero as well.
Wow.
Yeah, they were able to follow it and make sure of exactly the repair that was going to be needed ahead of time. Well, we were basically informed from the beginning that because he was in the hospital for so long, he might have some developmental delays, like physically. So immediately afterwards, we were hooked in through a social worker at the hospital who helped us find, they call it early intervention. And so it's a group in Mecklenburg County that helps coordinate all of that for him. The only thing we've had issues with so far is recurring sinus infections, and he's actually been hospitalized since birth 3 times, twice for pneumonia and once for RSV. I mean, he does see an immunologist, but the immunologist believes that it's more structural at this point.
So structural in the palate area?
No, probably just more in the adenoid area, like because he isn't a very strong eater either, so we think that some of the gag reflex that he has from eating sometimes might be related to that as well. We're just not sure.
You're married, your husband has a child who has some physical problems from his first marriage. And
Right.
tell us about those medical problems with that child.
Well, he just was always sickly and nonverbal. He would point and just was like, he couldn't communicate with us. And I'm not sure how it came about to getting the diagnosis, but at age 6 is whenever they actually tested him and he was diagnosed. But whenever he was first born, I know he had to have 2 open heart surgeries at birth.
Colin is born after a normal pregnancy, maybe a week early, but everything's fine as a little baby.
Yes,
What
well,
was the first thing you noticed that made you concerned?
I guess his verbalness, because it was like he had started saying words and stuff, and then it was like all of a sudden he just kind of quit.
At what age?
It was probably like age 2, because he was delayed on just about everything, and he didn't walk till like age 18 months to 2 years. So like all of his developmentals were delayed as a baby. So, and like I say, I knew that the older brother had been diagnosed, and so that was concern to me because I'd seen a lot of the same features and things like that in my son. And
how'd your conversations go with your pediatrician during that time?
it was just always like, you know, I would mention it, or I would ask, you know, could we test him? You know, I have a feeling that this is what's going on with him. And most of the time it was just, you know, this is stuff that he'll outgrow, like the asthma and, you know, the nonverbalness and that kind of thing, that he would outgrow it as he got older.
Did that frustrate you?
Oh, it was very frustrating.
And you're a parent who has obviously a good education, obviously resources, connection to the internet, and you can go and do that and bring that to your pediatrician's attention, but somebody who didn't have your background, education, or computer even.
Right. No way.
How would that have been for you to...
Oh, I can't even imagine. Yeah. And even as an educated parent, finding what I did find was horrific, because, you know, what I found was everything that's possible with 22q.
When you're reading this menu of potential things your child can order,
Oh my gosh.
he does, what are you seeing and what is your fear?
You're devastating, because what you believe, everything that you assume for your child, all your hopes and dreams all suddenly have changed, because you're now faced with a quite different reality.
The next video you'll see is several families talking about the preschool years. These themes range around addressing the whole family, how to find time to address the whole family, and decisions about preschool services.
He's had 4 surgeries on his soft palate. He did not have the cleft lip or anything like that, just the cleft palate.
Was he choking a lot before those surgeries? Or?
He was, well, he was 9 months when he had the first one, and he was being fed through a cleft palate bottle, and so I had 30 minutes to feed him, and I could feed him with a regular bottle for 30 minutes, and after the 30 minutes I had to pour the rest of it in a cleft bottle and squeeze it into him. He had a lot of trouble gaining weight because he didn't eat much, and so I was at the doctor about every other day for a long time. Wow. And you know, would go in through the back door and those types of things, so I wouldn't be exposed to anything. But he was about 9 months when the first surgery happened. Yeah.
So you were really just dealing with emergency medical issues right at hand.
Health issues, yes.
And the diagnosis was just kind of off on the side.
Yes,
there.
I was just in survival mode. All I was doing was surviving. I had to quit my job because he made it through the summer, and then I went back to school and was teaching, and the pediatrician said to me, you know, I really think you need to consider being at home with him. And he needed services. He needed physical therapy, he needed occupational therapy, he needed play therapy, he needed all those things, and I needed to be home with him. So we had to make that sacrifice for our family. The doctors were saying you need to wait until he's 3 before we do any kind of speech therapy. And I pitched a fit because I wanted him to be seen and I wanted him to have speech therapy. And so when he was right around less than 2 years old, I finally got somebody to listen to me, and they evaluated him, and he had the speech of a 9-month-old at 2, and they started speech therapy, and he was the youngest one in Catawba County to start speech therapy for them, and it made a world of difference. Now, he still had to have speech therapy when he started again when he was in 1st grade, but just the difference and him having that little bit of extra time made such a world of difference to him. And he was talking so much better than he would have been if we would have waited till he was 3.
Can you tell me some more about the things that were going on when Linnea was 5? You mentioned breathing tube, or was it a feeding tube?
She was actually younger than that because she had the strokes during recovery from her heart surgery. She went into grand mal seizures as well for 36 hours, and that's where she had the strokes. She came home on a feeding tube for several months. She had therapy. She was on a walker. She had braces. First had her, AFOs, and then up to her shins. We did physical therapy, occupational therapy, speech therapy, all within the house. She didn't have an immune system, so she was isolated. That was coupled with she has a brother 13 months older than herself, and then I had one in kindergarten. So those days were kind of blurry. When I look back, when she was on the feeding tube, it took 14 hours a day to feed her with a toddler and a kindergartner. So she developed RSV, spent months in the hospital, and then came home quite compromised as far as just failure to thrive, and she spent the better part of her year in the hospital as a newborn. So just incredibly stressful, and trying to juggle and not forget the other kids and not be so focused that they become paranoid and very afraid.
We were home 9 days after he was born, and he started to be really pale and musty color, and he was cold. So we rushed him to the ER, and that's where we discovered he had a congenital heart defect. And so from there, his heart defect and 22q kind of go together, correlate. So they did the FISH test, and that's how it was determined. So we had no clue.
It was just something we had no idea about.
Yep.
And how did that impact you when you found out?
It honestly did not, because we were so concerned and focused about his heart that was very little at the time. But now, as he's older, that's more of the factor than his heart, because he's in a good place right now medically. So now it's really starting to, okay, yeah, this is why he does this, or this is why he does that. And he was in the hospital for the first year of his life, so he kind of has that against him on top of the 22q. So it's like all these different factors, that are playing together with his, development. He had his first surgery at Levine's in Charlotte, which lasted 17 hours, and they corrected. He had interrupted aortic arch, VSD, his capillaries were
too much.
Yeah,
multiple. It took 17 hours for that surgery.
And then he was doing great. The only issue was feeding. He wouldn't take a bottle, so they put a feeding tube in. Doing well, and then right before we were supposed to go home, he had a cardiac arrest. So they discovered he had a blockage in his left main coronary. So we went to Boston Children's Hospital, and that's where they put a stent in. Did well. We were going back and forth throughout the summer, and then he ended up having a heart transplant on October 31st, 2009.
Wow, so you've already had a transplant.
Yes.
One of the first questions I asked the doctor when we were diagnosed was, is he going to be able to go to school? We don't have a normal like everyone else. It's our normal. It's Luke's normal. So for us, after we got the heart stuff as healed and in a good place as we could, we both started focusing on developmentally where he was going to be with his peers. And he's catching up. I mean, he receives therapy 3 times a week with speech, OT, and PT. and he's made huge strides. There's still speech delays, there's still communication otherwise, and some other delays, but he's starting to make that track. So he's at the age now where he's going to be deciding whether or not he's going to kindergarten next year, and I think I'm a little bit easier to let that hook go than Mom.
We had his IEP meeting back in December, and we were kind of more leaning towards going ahead and starting him, but then he would be in the special needs classroom half the day and then a regular classroom the rest of the day. He's only been in this More For program for a year now. I think one more year of that program will really get him even more prepared. I don't know if I'm ready to send him off yet. He isn't potty trained yet, and I would really like for that this summer for us to work on that really hard and have that done before we do send him off to school.
Having one child that has the deletion and one that doesn't.
It's a balancing act. The interaction with Drew, his brother, because Drew wants to play and is at that age where he can play with toys by himself, and then Luke will come in and knock him over or something like that, and he wants us to discipline, and Luke just doesn't understand that yet.
This next section deals with the elementary school years. Top of the list in these years are problems at school, and also including social problems. And not to ever be forgotten, the ongoing medical issues.
When she got in the first grade, the ending of the first grade, we started seeing some learning issues, attention issues, and I don't want to say obsessive compulsive, but sort of those issues also. Organization skills, getting herself together. That's another thing I noticed. Putting papers together, keeping stuff in place, and the forgetfulness. This is, I put this there, I forgot where that, or learning something. Now, in her learning process, reading and spelling is her high point. She loves spelling. For math, it's totally different. Math, she can't count on her fingers. She's 8, and they're doing multiplication, division, and if you tell her to put 4 plus 2 together, it's difficult for her to do this on her fingers. She just lost her hearing in October. It made me very depressed. Because I'm like, this is another thing she has to go through. This is another device she has to wear. she just had surgery February 2013, and now she has to wear this hearing aid. I have to have her in my sight. I have to be her protector, because other people are not. I don't want nobody to take advantage of her. I don't want her to be, bothered or be out there scared. Children heal kind of quickly, but the older you get, your body is different now. So when she gets surgery at 19 or 18, how is it going to be? Is it going to be as easy as it was when she was 8, or is it going to be something that I'm going to be in a hospital all over again, sitting with her, hoping that she can go through, get through this?
He's never had a best friend, and that's, I think, one of the most heart-wrenching things as a parent to watch, is your child not have a good friend, not someone that, especially when they're young, that they can have to come over and a buddy to play with. Caleb's never had that. He's just not socially mature. He doesn't know how to be a friend. Part of it is that they're in that self world, and he's in that self world. It's kind of his little world, and he likes his little world, and so he's got to learn to do those kinds of things and reach out. Plus, it's a maturity thing. He's so much more immature than other kids his age, that they don't like the same types of things that he likes. They can't fit a square peg into a round hole. A program, you cannot make a child fit a program. Caleb doesn't learn conceptually, he learns procedurally. Give me A, B, and it equals C. That's the way he is. And I want those teachers to understand that these children don't all learn the same, to understand that he is what he is, and there are certain things about him that we can't change. Yes, we would like him to slow down. We would like him to read more. We would like him to take his time on assignments. But I've heard that since he was in first grade. If he would just slow down, well, we've tried everything, and he's on medication. He can't take any more medication than that. that's one of his quirks, you know, and so I want them to understand that, and I want them, especially the older he gets, it wasn't as bad when he was in the younger grades, but the older he gets, the more they just want him to be a uniform, like every other child, and he's not like every other child.
They just didn't understand him, or, you know, couldn't relate to him.
Did you talk to his teachers about that?
Well, I'm sure I did, but at that point I didn't have a diagnosis, you know, to go on or anything, so it was like I was just as baffled and confused, I guess, as the teachers were at that point. The allergist is the one that, you know, she noticed the facial features and the symptoms and things like that, and after doing some allergy tests and a couple different things, then she did the fish test, and that's when it was discovered.
And when did you find out that he only had one kidney?
Shortly after he started coming to Duke, because after we got
so he was 10?
Yes, so I mean, it was by God's grace, I guess, that I had never put him in any sports or anything like that. He's not organized. He has no organizational skills at all still. So it's like he loses homework. He loses pens and pencils and paper, and, you know, it don't make it from school to home, or it doesn't make it from home back to school, or he's just calling. I just accept him for him, you know. So for me, it's just natural and normal, and it's just part of everyday life. But for other people, whenever they're around him, a lot of times they don't know how to take him, or, you know, because a lot of times his behavior still is like, his social skills, I guess, more than anything, is just not right where they should be. With this syndrome, you know, he's developmentally delayed, so he's not, you know, he's always been at least 18 months behind everybody else. So whenever you put him in with students his age, you know, they may be on grade level where they're supposed to be, but, you know, he never was, and he still isn't. I mean, even his reading and stuff has improved, but he's still not at grade level, you know, where the rest of the students are. So it just takes a lot of time and a lot of patience and a lot of repetitiveness, and, you know, modifying their work for them to where they can, you know, be successful and feel like they are making an achievement. Because before, you know, before they actually understood or was accepting of the fact that he had a disorder, you know, they just set him up for failures the way
I think it was probably the end of second grade when I first brought it up in the IEP meetings, and I noticed that there would be birthday party invites that had gone out to other people in the class, and Ethan didn't receive one, and he would ask about that. Why doesn't anybody invite me to their house to play? I see all my friends going over to other people's houses, and why am I not invited over to play at their house? And because we would arrange play dates for people to come to our house, but I would see even in those play dates that he just was not always able to engage with the other child who had come over and keep them interested in wanting to stay and play. Or he didn't understand that when he was done with an activity, he needed to let his friend know, I'm done with this activity, let's do something else. He would just walk away. It made me hurt for him. It made me sad because I knew that he really wanted to have those friendships. So it made me sad. Sometimes I would be frustrated because, you know, in that moment I would see it happen. I'd be like, why did you do that? Why?
Did you feel angry towards your own child?
Sometimes, yeah, and then I would feel the guilt of, you know, how can I be angry with him when he didn't even understand what was going on? That he will not have friends, that he will find himself in a place that he doesn't feel comfortable and is unhappy with himself, and would then not want to be open to talking to us or talking to other people, and might eventually want to hurt himself. And that's the, you know, when I have those really strong moments of fear and anxiety, that's the path that sometimes I worry about the most.
And now we're moving into teenager, adolescent life. The emotional issues you'll hear about in the upcoming stories, need of ongoing support, and fear for the future.
but it's always borderline.
So do you find that because he's borderline that he's really kind of falling between the cracks?
Sometimes
The what?
yes, but that's why he has such an awesome mom to step up and advocate for him.
Sure.
So falling between the cracks means this group of people needs a whole lot of help, so they're getting a lot of help, and this group of people doesn't need any help because they don't have any problems, and then the people right here in the middle are like, where do I go?
I'm in the crack. I need to go that way.
My hopes are that he graduates with a high school diploma and not a certificate of completion. He might just get a certificate of completion. Well, then he can't get into college. And you know, I want him to grow up. I want him to have those opportunities. I want him to at least have the chance. So that's one of my hopes for him. My fears are that he'll be bullied, that he'll be led down a path that he doesn't comprehend or doesn't understand.
Adults adore him. Other children seem to know that he's different. Obviously, the older he gets, the more apparent it became and becomes. He speaks of friends at school all the time, but they don't ever call. They don't invite him over or invite him out or anything like that. He does play Xbox online with friends from school, or people from school. I don't know that they are friends with him. I mean, it doesn't ever extend beyond this Xbox relationship. One of the biggest problems we have with him is when he commits to a path that's not a good path, cannot get him off of it. Just cannot get him off of it. His short-term memory deficit is it's a pretty big hurdle in trying to remember where he put things, remember, what he was supposed to do, when it was supposed to be done by, things like that. Mm-hmm. His organizational skills are so horrific, and I don't know if JD has this Vaughn's memory is horrific.
I was bullied by 2 girls at least at school. Didn't want to tell anybody because I wanted to, because I know that there's going to be people that's going to not like you no matter what. So I just put up with it. This one girl, let me see. Oh yeah, I was just sitting in a chair in computer class, and she's like, "Will you please move?" And I'm like, "No, because I wanted to sit here." Move. She was being rude to me, and the other girl didn't like me when I was stretching, because I do that sometimes. And she told me to stop stretching rudely, so I cried about it.
Or when it's time to do homework.
Oh yeah, when it's time to do homework, I get confused, I have homework, or I feel like I just can't succeed if I try. Oh, I'm so dumb.
But you're not.
I'm never gonna do it. I'm never gonna be able to finish it. What's the point of doing homework if I'm just not gonna be able to complete it?
Okay, so Adam is 17 and a half. He is currently in the 10th grade. He started a year late and he repeated 2nd grade. So he still has 2 years left in high school. He's afraid to do so much that it's difficult to teach him. So it's all the unknowns, I guess, really, that are the fear, because it's so hard to work with him, because he just despises not knowing. And when he doesn't know something, it makes him angry. And then you can't teach him, because he's kind of closed down to it. He thinks he should automatically know so many things because he's a certain age.
He's highly anxious. So we do have to kind of work with him to talk him off the ledge, so to speak, when something goes wrong. I mean, it's an immediately just kind of blow up. They talk about having those moments, so to speak, like with the schizophrenia. It seems like some really crazy event kind of takes place that just, flips the switch on them, so to speak. Well, we had one of those at the end of 8th grade. We worked with Dr. Sashi a good bit.
What was the incident that kind of set it off?
Testing. The testing and retesting. And it really had him, we were scared for a while. No one in the family had ever seen him that kind of crazed. I don't know what word to use for it.
Christopher, who's 14, and we're talking about, he was only diagnosed a year ago.
Yes.
So you're just now sort of finding out what it means, what 22q means, and...
I took, as I said, a pediatrician, then I took him to a urology doctor, and he was on the medication, 1 at night, 2 in the morning. Then his behavior got worse, and then they put him on another type of medication for ADHD. And I said, something ain't right here. He kept saying the medicine wasn't working, so then I I made an appointment to Duke University myself and brought him in, and the doctor says he doesn't have no seizure.
They thought the head turning was a seizure-like activity?
Yeah, because they thought maybe he had a steering type. I would call him and he wouldn't answer. And I didn't know if that was a seizure where he didn't hear me, that he blanked out for a minute and came back, or was it that he refused to answer me. The grades started going down. It was A, B, B, C's, and then my husband passed, and the grades just started going down. Like now, he's D's and F's.
And what does he act like when things are not good? When, like, at the worst, what's happening?
His behavior changed. He wants to yell, and I try to talk to him, and there's a screaming match, and then I realize he's not listening. He goes to his room, slam the door, lock the door, put the bed up against the door, and sometimes I'm afraid to answer the phone when I see the school number comes up. I'm afraid to answer the phone because I'm thinking, like, what did he do now? I'm afraid that he may end up in jail or in an institution. I really am.
And why do you think that could happen? Is it because he doesn't understand?
He don't
what
understand.
People are saying to him. He doesn't understand the situation.
He just don't understand.
And now we're moving into the young adult years. There are issues of employment, finances, volunteer work, living independently, and most importantly, mental health issues. In fact, in our discussions on social media and through the support groups, this was the single biggest issue in the young adult years. And you can see from some of these comments on those support groups that the recurring theme of mental health is over and over again expressed as a great fear. In fact, those last two comments, schizophrenia, 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 it's a huge fear. And a parent said, unfortunately, that fear is here with us now. And it was very difficult to get people to talk on film about this because there's so much pain involved around that mental issue. So listen here to some of our young adults.
One of the things that's really difficult is that where you can reason, because she's my third girl, and you swim through that hormone soup with all these girls, my older girls got to the point where we could say, yeah, you feel really out of control and you feel really irrational, but there's a reason for it. And so we can take a breath and we can use some coping and we can move on. With her, she doesn't have that self-awareness to kind of take the breath and go, okay, this is normal. Other people feel this way. It sucks.
So how does she behave when you're in one of those conversations with her?
Oh, lots of screaming, lots of meltdowns, lots of storming off, lots of you don't understand me. You know, everybody hates me here. You guys don't understand, that kind of thing, which in some ways is typical teenage behavior. But she's now 19. She's not, 13, 14, 15. But the maturity is very slow to come, even though the physical aspects long since arrived. She doesn't always know when to ask for help. And she may just get really angry at the person or snap at them. And so we have to role play, okay, well, when this person does this, this is what is appropriate to say. And this is what is not appropriate to say. And that's a really hard thing for her. She needs sort of constant support in that, so she knows, it's not okay to yell at this person. It's not okay to shove this person. It's not okay, to call this person a name. This is what you do in this situation, or you go get help. And we're not there yet. If she were to have a mental health crisis, there are so few placements for her. If she had to go into an inpatient program, or if her own safety or whatever, there are very few places that either will even take a developmentally delayed child with mental health issues, or if they take them, really know what to do with those children, young adults. My fear is that I can't live forever. Her siblings can't live forever, and how do we know when we're not here to take care of her that she's taken care of? How do we know that the world in general is going to watch out for her at all, because she's not theirs?
Did you get a job yet at that point?
No, we were working on it, but there was just no job whatsoever in Bowie. I walk the dogs, I bathe them, I play with the puppies, fundraising, community events, help them get their parvo shots, like to listen to music, like to be on the internet, and love to go swimming, love to go fishing, and love to travel.
So, do you handle your own money, or does Mom do most of that?
She helps me with it. I got a pretty good idea of it, but she helps me just in case.
Okay, that's great.
Yeah, we've elected for, at least now, for Linnea to be her own guarantor. She signs everything, and we're usually there with her, always there with her. But as far as legal documentation at the bank, at the doctors, it's explained to her, and she does the signing, she does the authorization, and we're just very supportive for clarification and also to make sure she's not taken advantage of.
And now we're moving into the last compilation of videos, issues around childbearing. So there's two issues here. There's, first of all, concerns about reproduction for older teenagers, adults that have the deletion, and what would happen if there was a pregnancy. And then we're also dealing with healthy parents who have already had a child with 22q, and then their decision to go forward.
Are you starting to think about his sexual maturity and his family life in the future, and what are your thoughts there?
Well, I mean, we have had conversations, preliminary conversations. I mean, he's had at our school they talk about sex education, and he's had sex education, and he's just still so incredibly immature when it comes to anything like that. It's a delicate topic, because you don't want to say, you can't say, Vaughn, if you get a girl pregnant, she'll have a baby and the baby will be just like you. And he'll say, well, what's wrong with that? Or you can't think just like you. You'll have, we'll have 22q. You know how you've spent your life going to doctors, going to therapy, going to, PT, doing all of these things, and how school's hard for you. You certainly wouldn't want that for your child, is how we would ultimately approach it with him.
Tell us again how old you are now.
16.
In what grade are you in?
10th.
10th grade.
I don't want to have kids because if I do, they'll probably have my disability, but it'll probably be worse. I think it'll be very hard for me to handle.
Because what I've heard that where it's so complex that it could possibly skip a generation, or there could be no symptom. They could have it and there could be no symptoms at all. So it's kind of like 50-50.
Yeah.
So that's what I've read and what I've been told.
How do you feel about having children someday?
I love children. I work in a preschool, so I would love to have children of my own. Yes, I talk to my mom a lot about it. I would either probably adopt or do surrogacy.
Mm-hmm. And why would you do that? Why would you make that decision?
Because I honestly, I wouldn't want my child to have to go through the same stuff that I went through with illness. So that's one of the big reasons.
Mm-hmm. We have had a lot of anxiety in that area because she is very naive. She is not a good reporter of what has happened. She can have a conflict with a sibling in another room and can't accurately portray what happened. When asked a question, she is more likely to tell you what she thinks you want her to say. She can be convinced to answer in almost any way.
Have you dealt with sexuality issues yet?
We have not delved any further really, other than just their natural processes of puberty. She knows like very basic reproductive things. She has not been interested in having a relationship. I haven't crossed that bridge. I mean, I do think about, well, gosh, if she had a child and the child also had 22q, she can't really handle her own affairs, so I doubt she could handle the affairs of a very medically complicated child. And that would be something else, we would have to be involved in most likely, because I just feel like she doesn't, she's very naive, she's very, I think she's probably would be potentially very vulnerable to being exploited.
My name is JD. I'm 30 years old. I had a girlfriend a couple of years ago that had BPSF, and I didn't want children. And so I decided to get a vasectomy. And I talked to my doctors about it and my parents, and went ahead and I had the surgery for it. And I didn't want to have kids with BPSF either.
And Caleb is our only child with 22q11, and no one in our family carries it. His was sporadic.
So what's the age difference again between him and the next child?
5 years.
5 years.
Mm-hmm.
What went into your head during those 5 years, and what kind of decisions and support did you get with making the decision to have another child?
We decided to have another child. We knew we wanted to have more children, and we knew we did not carry this syndrome, either one of us. But when I got pregnant with actually both my girls, I did choose to have an amnio with both of them to find out if they would have the deletion, just because when Emma was born, she was born at a very small hospital, and we knew that if there was going to be a birth like that, because his birth was good, but it was the after the birth that was very traumatic for us because of his heart issues. And so I did not want to have to go through that again, so I knew I wanted to deliver somewhere closer to Baptist in Winston-Salem. So we did genetic counseling and did the amnio with both of the girls to find out if they did not have the deletion.
We would like to think that we could have other kids, but we don't know if we could necessarily handle other kids in the future because of how much we do put into making sure he's taken care of. So it is kind of a place where we haven't really decided yet, I guess. Mm-hmm. Even though the idea is reasonable, we would also have to get genetically tested to make sure that we'd know what we're in for, I guess, with another child as well.
And the third part, by way of summary, what we want you to know is that early on in the diagnosis, we might be in denial, but give us some time, give us support while we get to understand and know our child's challenges. This is really hard. We need your support. Listen to the parents. They know their child. This is a partnership. You're my child's teacher. You're my child's doctor. I need you.
I have one very important thing to say. If I could define my child medically or academically by one word, it would be borderline.
Borderline.
If they would have just listened, I guess, would have probably maybe had made a huge difference and more of an impact on his educational part, because without the information and without that diagnosis, it was really difficult to get through to anyone, even though I had asked repeatedly, could you test him? Would you test him? This is what I think's going on with him. Even, I know I have no medical degree, but having already had the older brother and being familiar with the disorder, I felt like I just wasn't heard as a parent. It was just like I was shut down because I didn't have that medical degree and I didn't know what I was talking about. Come to find out, I knew exactly what I was talking about. So for me, that was the most frustrating part, I guess, was just not being heard.
Well, and maybe someday when I see a doctor for, a physical, that I'll put VCFS or 22q or XYZ, whatever they want to call it, and the person will say, I know what that is. Mm-hmm. So that would be great, wouldn't it, Mary?
Yes, it would.
Good job.
And we're going to give you some additional support and educational resources. The Dempster Family Foundation has information for families, teachers, and physicians. There's contact information for support groups on their website. And there's available books, upcoming conferences, opportunities for camps. And that's the DempsterFamilyFoundation.org. The International 22q11.2 Foundation, or 22q.org, has resources for each age group, including newly diagnosed. It has information about upcoming events and fundraisers, and resources for educators and physicians. The Velocardiofacial Syndrome Educational Foundation, or VCFSEF.org, has wonderful library with fact sheets and informational brochures, information about upcoming events and fundraisers, and it has a list of support group contacts.